Diffuse large B-cell lymphoma is nowadays probably the major indication for CAR-Ts, and it's the pathology or the disease where we have more patients being treated outside prospective clinical trials and in real world. We have two major indications for CAR-T in relapsed refractory diffuse large B-cell lymphoma. The first one is in those patients that fail at least 2 prior lines of therapy, so third line or eventually later lines of therapy. Here we have 3 prospective clinical trials that were published several years ago. We have long-term follow-up of patients included there. We have quite a lot of patients being treated in real world outside prospective clinical trials. So here we have evidence that CAR-T can represent a curative therapy for at least 35 to 45% of the patients. The next indication that we have that has been approved by both the FDA and the EMA, only for 2 constructs, or for axi-cel and for lyso-cel. In third line or plus, we have the 3 constructs, axi, lyso, and tisa-cel. So for second line, we have axi and lyso-cel, and basically it's looking at primary refractory patients with diffuse large B-cell lymphoma and early relapses. So relapses within the first 12 months after the beginning of first-line treatment. It's already in this indication. Probably there are some data coming from real world in US. I think that it's too early to talk about a big number of patients being treated in real world in Europe. And of course, probably there will be additional indications in the future. So there are data indicating that for high-risk patients with diffuse large B-cell lymphoma, maybe CAR-T cell therapy could be an interesting treatment to check. So we have the data coming from the SUMA-12 trial that included only around 50 patients. And for these high-risk patients, the use of axi-cel gave really an interesting duration of response rate, progression-free survival, and overall survival. So maybe that was only a proof of concept. So maybe in the future we will have prospective randomized clinical trial that would be trying to look for another indication for this group of patients.